shot clock strategy. Just to continue on with county block grants. So to date, you feel the county block grants have been effective for counties moving forward, and there's more that have requested in to date.
I think that some counties have made very good use of block grant funds. Others have a little work to do. But I think overall
good.
Overall, I think the counties have done a decent job with the block grants.
Okay. The Centers for Excellence. Can you let us know how many people have contacted the Centers for Excellence? How many have been serviced by the Centers for Excellence? Their recidivism rate to date, and the overall cost expended thus far. Are you going to be over budget, under budget with those centers?
So I think
forward?
we'll be on budget for them. The first report we got was for January numbers. As you may recall, some of them, the second set of 25 didn't even really get started till January. So we only have, I think, something like 26 of the first 45 for the first month's worth of data reported so far. So the numbers that we have are for that first month for about half of the COEs. There were about 582 folks. There were 582 folks who got services. Those numbers will grow over time as the second set start reporting and we get more months of data. A lot of what's been going.
When's the date? When do you require the information? The
data comes in, I think, on a monthly basis, and I think that some of those. Is that right, Jason? Sure. On a monthly basis. So we're just getting the first set of data in, and we're analyzing that data. So it's probably too soon to tell on some of that, but generally, folks have started putting that money to use to hiring additional staff, beefing up their services, and providing more services in that comprehensive way that we think is very important.
At what point will you have all 45 centers data in as a baseline?
I hope as soon as possible. Some of those folks are just getting underway. As soon as we have the data, we'll be able to report it to them. But my hope is in the next month or two, we'll be able to have a full set of data in.
Okay. In about 1 to 1.5 minutes, can you give a short summary? This is a big question. Can you try to give us a short summary of the strategic plan the administration has developed to facilitate the merger, goals, objectives, sequence of steps, and timeline of those steps?
So, 1.5 minutes. So I think that overall the idea is, I've answered I think the overall strategic direction is to achieve 3 goals. The first one is to make it easier for the consumer to access services. The second goal is to provide those services in a more cost-efficient manner with less bureaucracy and paperwork. And third is to save money. I think if we hit all 3 of those goals, the consolidation will be a success. We have the framework in place for that. We are beginning the process of working with the General Assembly on that. We have some initial initiatives that we think will save $94 million, and we've also begun discussions with stakeholders, including counties, providers, and consumers, and if we, moving forward, we'll be able to implement the vision.
Do you have a written strategic plan?
A written strategic plan. I don't think we have a written strategic plan. I'm not a big fan of strategic plans, but I think we can put together a summary of that vision for you if you'd like.
That would be great. Sure. I think it would help the process moving forward if we can see timetables of when mergers are going to happen. Particularly if this, we need to verify that this, in fact, will save money, provide better services to Pennsylvania residents.
We can certainly provide you with a summary of the savings and what we think will be accomplished by July 1st with the help of the General Assembly.
So there's a couple things that worry me. $200 million, over to it, $243 million in supplementals this year. We have about $100 million in federal disallowance coming up. So there's some financial issues within your department currently, which is a very, very large department to begin with. So with those spending issues moving forward, how do we know that a consolidated department with the financial issues of the current department will actually save dollars and help reduce costs moving forward?
So I think whether it's the proposal for in Secretary Murphy's neck of the woods with state health centers or the county assistance officers, the county.
So no offense, but you can do those without merging.
I understand that. So
let's pull that stuff out. Mm-hmm. What in there is actually going to, even continuity of care? You said breaking down barriers.
So first, I would say I think you could do pieces of that without a consolidation. I don't think you could solely do those without a consolidation. So respectfully, I'm not sure I 100% agree. I agree there are things that you could do, right? But some of those things require some consolidation and coordination that we have. So I'm not sure I 100% agree with that. With regard to the disallowances, you had made reference to the size of the department. I think that sometimes those numbers, it's a very weird thing to talk about those dollar values as being a relatively small percentage of the services you provide, but they are there. We are always working with the federal government. Every state in the union has some level of disallowances that they're working with the federal government. The level that Pennsylvania has is actually a little bit lower than some other states. I remember I reached out to the CMS director about trying to address some of those disallowances, and she said to me, compared to some other states, you guys are not even on the radar screen in terms of some of those are. Those take a long time to resolve. They are the nature of the business when you're dealing with the federal government. So we're doing our best to work through those, but I'm not sure that they're anything that would affect the benefits that are associated with the consolidation. And I would argue, too, that should some of those deferrals or disallowances wind up having to be paid, having a consolidated agency that's as efficient as humanly possible will allow us to absorb any disallowances that we do have to pay. So,
out of the lottery fund?
Representative, I have to cut you off.